by Lisa SchleinThe UN Children's Fund warned the Ebola outbreak in Democratic Republic of Congo threatens the health and well-being of children, and special care must be taken to help them survive. Ebola is highly contagious, killing between 20 and 90% of its victims, and the UN Children's Fund is engaging communities in the fight against Ebola. UNICEF spokesman, Christophe Boulerac, said schools are crucial for minimizing the risk of transmission among children. UNICEF is scaling up prevention efforts in schools across all 3 affected health zones, he said. This includes ongoing efforts to install hand-washing units in 277 schools and supporting awareness-raising activities reaching more than 13,000 children in Mbandaka, Bikoro and Iboko. Previous outbreaks of Ebola in DRC and most recently in the horrific epidemic in West Africa have shown the high level of trauma experienced by children at the loss of family members. Boulerac told VOA orphan children often become social outcasts because of their association with this fatal disease. There is, as you mentioned, rightly, the risk of stigma and the risk that the child, when his father, his caregiver, his mother is affected, the child is psychologically affected, he said. Boulerac said UNICEF is taking preventive measures, including providing trained therapists to families affected by the Ebola outbreak and helping children cope psychologically with the trauma of losing loved ones.